Now this patient has a little bit of subluxation here, and this is something very common here that we see weakness in the insertion of the medial collateral ligament, but it often does not show up on MRI. One of the questions that comes up commonly in our office is how do we do what we do without ultrasound or fluoroscopic guidance? I perform most of my treatments by knowledge of biomechanics, a very accurate physical examination using palpation, and a comprehensive treatment of the area. Now, while this has been debated which is better, studies have shown that a skilled physician should really be able to place the injections very accurately by knowing their anatomy and knowing how to examine someone. Many people are going to technology rather than relying on what's important, which is trying to figure out what's wrong, to use your brain and to use your hands, which tells you most of the information. Unfortunately, we can't rely on just MRIs, dynamic x-rays, ultrasound, etc. You have to examine the patient. So we're also going to have the patient walk back and forth. Here we do see that her foot is rolling in and her arch is collapsing. So since she has an ankle problem, if we don't treat the arch, the ankle problem's not going to get better. We want to treat the person, not just an image. If we treat solely by ultrasound and don't examine the patient, we're going to miss most of the areas that need to be treated. One of the most common areas that treatment using ultrasound is performed is in the rotator cuff. Here we are injecting the bicep tendon, which is a very commonly injured area, along with the rotator cuff. Often does not show up on imaging. Treating with ultrasound may not be proper because you just treat into one defect, but the ultrasound's not going to reveal every defect that's in the shoulder. If you're not treating all of the accessory ligament and tendon structures that perhaps are damaged as well but are not showing up on ultrasound, you're going to miss where you need to treat. I know that it may seem that technology is going to make things safer and better, but clinical studies have not shown that. I think that the patient gets much better results when we treat the patient through a complete examination and complete diagnosis and complete treatment of the damaged area, rather than relying on treatment of an area that's seen in a picture in a very limited capacity.